Okay, I have more tea for you on Orlando Regional Medical Center, but I'm just gonna warn you, it just keeps getting really dark. So I'm just gonna breeze through some of the many messages that I've gotten from so many nurses at that facility. Oh God, here we go. Okay, so this person confirming that the patient did jump out of the unit 8C. Apparently the patient had been banging on the window with the bedside table, and the patient below heard it and thought it was construction. The staffing was so bad on that unit that the staff didn't hear it. The med-surg floors are 10-1. They're also threatening nurses with patient abandonment if they don't take the assignment. Listen, that's not true. If you don't accept the assignment, it's not your patient to abandon. Don't listen to that. She knows at least one patient coded based on the staffing because the nurse had seen him at 7 p.m. and didn't get back to him until 12 a.m. and he was unresponsive. Orlando Health claims that they're not making enough money. That's a bunch of bullshit. Also, ORMC's emergency department is a level 1. They hired 17 new grads fresh out of school, not enough experienced nurses to teach them, and you only have to have 6 months experience now just to get in. Another nurse confirming the walkout. She's not sure about the number though. Again, saying it was the 8th floor bedside table, saying nobody knew because of how many patients they had. And I quote, Orlando Health quickly got rid of the body and the mess to avoid any news coverage. They also made sure we had staff ratios while AHCA was investigating to make it look like staffing wasn't an issue. Okay, so ICU is 3-1, step down 5-1, PCU 5 or 8-1, and med-surg 10 or more to 1. Patients are dying because of unsafe ratios. Oh my God, nurses have had patients who were higher level of care be transferred dead on arrival because there weren't enough rapid response nurses to assist with their transfer. And I have had multiple people tell me this one. We had a patient set themselves on fire. Another patient eloped, ran into traffic, and died. Orlando Health is refusing more pool travel nurses and no longer floating nurses to help other units. It's now each unit to find coverage, and there's no coverage. They haven't given annual raises in over 2 years. Another nurse, she wasn't there that day, but she heard that the ratios the day the person jumped out of the window was in the double digits on the PCU floor, promising the staffing issues will be fixed by October. Also saying graduate nurses are being put in these positions where they're taking double-digit patient assignments. That should be illegal. Okay, another nurse, yes, the patient jumped out of the window. They had to code him in the trauma bay afterwards. It was emotionally crazy afterwards. Nobody spoke to them. Nobody checked on them. The conditions are horrible. Another person saying everything that we're talking about, it's all true. Again, talking about the horrible staffing and that ICU is quadrupled 4-1. Administration is downplaying everything. We asked for more money. They said it's not our culture. Telling us that saying our ratios are unsafe is strong word to use. Another person says it's as bad as I make it sound, and they can't keep any staff.